So this study presented by my colleague, Nate Fillmore, the purpose was to see effectiveness of the vaccine on in patients with multiple myeloma and also patients with the precursor condition, smoldering myeloma or MGUS. And the important difference in this study compared to many other studies is that this was not focused on evaluating antibody response, etc. This was actually measuring how many patients following vaccination got PCR positive myeloma. Developed PCR positive COVID. This study came on the back of our just recently published article in JAMA-Oncology just last week, which included all cancer patients and showed that the cancer patient in general do respond to vaccine, the dual vaccine. However, if these vaccines are given closer to chemotherapy, the responses are less. If it is given 6 months or later after last chemotherapy, the vaccine responses are very good, similar to what one would observe in average normal patient public population. So in this background, we now looked at how do patients with blood cancer, especially in our case, multiple myeloma, respond, knowing that immune system in this patient is not entirely normal. So this was study conducted at the Veterans Hospital, and we looked at, overall, we looked at 3,900 myeloma patients and 11,000 MGUS patient population. But looking at patients who go to the VA for surveys, we identified 880 vaccinated myeloma patients and similar number of matching unvaccinated patients. That's one cohort. And the second cohort was 4,798 vaccinated MGUS patients and a similar number of unvaccinated patients. So very large cohort. And there was some matching done as much as possible without changing the numbers too much, but age, race, location, rural versus urban population, etc., frailty. And what we identified and report is that myeloma patients do respond to vaccine. However, their responses are limited. So there is only compared to the control unvaccinated population, the difference is limited, and that this benefit certainly disappears after 6 months. And this effectiveness, and what we call it is the way we define our endpoint is called vaccine effectiveness, which is basically risk of infection among unvaccinated population minus the risk among vaccinated divided by the risk among unvaccinated. So what proportion of vaccinated patients are being protected, etc. And so if you look at this, the estimated effectiveness percentage in patients 14 days after the second vaccination was 5.6. Now the same number in MGUS patient was 27.2. So the MGUS patient had much better response compared to myeloma patients. Both of them actually had lower response than other cancers. However, compared to between the two, MGUS had more, which is what we would expect knowing the biology. MGUS also, around 6 months' time, their vaccine efficacy seems to be going. The incidence of developing COVID in vaccinated versus unvaccinated was very similar. Now, and then we looked at further, are the population of myeloma patients who respond better or the worse? And what we identified that if last treatment, myeloma treatment in a patient was more than 6 months ago, their breakthrough infection was only 2.6. But if it was within last 90 days, so if patients are being treated now versus in last 3 months, then this number increases to 5.2, much more chance of getting infected, less protection. And this number was 9.1 when patients were getting a drug called daratumumab, which is known to have some impact on vaccine responsiveness. So our conclusion of this large study was that vaccination is effective. However, it is reduced in patients with myeloma, likely due to chemotherapy, likely due to disease-related immunosuppression. And so these patients, even though vaccinated, do require that they take usual precautions with social distancing and masks and other measures. MGUS patients are a little better protected, but they are also have a little bit limited efficacy compared to general population, and they should also be careful when they're being managed or when they're in the public where they might be exposed to COVID.